The state of where we're at now is that the laws are pretty good. Over the last decade or so, we've seen significant advancements from a legal perspective. Nationwide, abortion has been decriminalised. Other legal measures have been put in place to protect reproductive rights. For example, across the country, we have safe access zones, meaning that anti-abortion conduct can't take place directly outside of abortion clinics. But there's still a lot more to do, particularly from a non-legal perspective. For example, there remain a lot of financial barriers to access. Most abortions are provided within the private sector rather than the public sector, which makes abortion unaffordable for many women or pregnant people. There are also other barriers like geographic barriers. So for people that don't live in the capital cities, for people who live in remote or rural Australia, there's frequently very limited or even no access to abortion.
So going to your first point, is there scope to expand access to abortion to the public sector across Australia?
Well, definitely, and I think that's really what we should be pushing for now. The situation at the moment is that there is broad acceptance of the fact that whole public hospitals can actually refuse to provide abortion services. And so what that means is that in large parts of the country, the only hospital in town may be a faith-based hospital that refuses to provide abortion. This means that people requiring abortions are really funnelled into the private sector because there are whole hospitals that are refusing to provide the procedure.
Was there any debate at the federal level? Just remind us about this, because I think when Tanya Plibersek was the opposition health spokesperson, she was looking into this issue about whether or not the government could intervene in some ways to make sure that more hospitals were providing abortion care.
And that's exactly right. So back in 2019, Tanya Plibersek, when that election campaign was happening, came out and said that if Labor was to win government, they would tie public funding of hospitals to a willingness to provide abortion services. Since the Albanese government has come in, that policy has actually been dumped by Labor, and so nothing really has changed, unfortunately.
Sorry, Rich.
Oh, well, I mean, it's a human rights issue, abortion, isn't it? But it's been seen as a bit of a women's issue and not a health issue. Sometimes I feel like the discussion doesn't really centre this as a health issue. Is that something you looked at in the book?
Absolutely, and I think it's really, really important that we frame this issue as a human rights issue. And it's important because the international human rights regime has in fact recognised abortion as falling within a number of established human rights, like the right to health, the right to privacy, the right to be free from discrimination, and even the right to life in certain circumstances. So it's important that we frame it in that way. It's also important because framing it as a human right puts the responsibility on government to actually act to protect those rights. It's not just a nice to have, it's a right that people have and that people can demand be implemented.
As somebody who clearly has studied this issue closely and written a great book about it, what do you make of the overturning of Roe versus Wade in the States, the impact that is having on American society more broadly?
So that was actually the impetus for writing this book, was the fact that in June 2022 we had the United States Supreme Court, the highest court in that country, overturning the landmark 1973 decision of Roe v Wade, which enshrined a constitutional right to abortion in that country. The 2022 decision meant that the status of abortion rights in the US reverted back to what they were in 1973 before Roe v Wade was handed down. So that meant that the various states could regulate abortion as they saw fit. So what we've seen happen in the US is several states enacting legislation which completely ban abortion or highly restrict access to abortion. So that means pregnant people living in huge swaths of that country need to travel to access abortion services, and if they can't travel, well then they simply can't access the service. We've also seen just very, very recently a court in Alabama declaring that embryos have personhood. So the reach of that 22 decision has now stretched into the IVF industry, so far beyond abortion, with IVF clinics freezing a lot of their practices.
Yeah, it's pretty staggering.